Whenever we go through a treatment for left-sided breast cancer, the two big organs we get concerned about are the lungs and the heart. After a course of radiation, long-term, there is data to show there's an increased risk of having heart disease because of the radiation itself when we compare it to patients who have right-sided breast cancers.
The heart is structured right up under the ribs, and the coronary arteries are in the front of the heart, and they can get scattered from the radiation beam. So when we treat with AlignRT, we have the advantage that we can have that patient breathe in and treat them in what we call deep inspiration breath hold. So if here's the ribs and here's the heart and the patient breathes in, it pushes the heart back. But then we need to treat them in that position. And so the AlignRT is shining on the patient. We're able to see on the monitor that they're in that breath hold position. If they exhale, we can see on the monitor and the machine will stop. We'll get them back into breath hold so we can accurately treat that patient, treat their breast, and not expose their coronary arteries. We have a lot of data that shows how very low doses of radiation can increase the risk of coronary artery disease. So our dosimetrist that does the treatment planning will look at all these data points and make sure that the heart is within tolerance.
So whenever we're giving a radiation treatment, we have to ensure that whatever we plan for based on the CT scan is the same treatment that's delivered to the patient on the treatment table. And so having accurate technology that can ensure that our patients in that same position, our beam angles are all lining up the exact same way that we plan for, ensures that we're treating the cancer itself and avoiding any normal cells. The first step for doing any radiation is to do a CT simulation. And that's a scan that we do in our department that we use to line you up every day for the treatments itself. Whatever we do on the scanning day, we need to be able to repeat every day for the radiation.
We're going to do 2 setup scans. In one scan, you're just going to be on the table in treatment position and just breathe normal. In the second scan, we're going to get you to hold your breath, and we're going to coach you through that.
Now, we need to be able to repeat that same amount of breath hold in every day for the radiation, and this is where AlignRT comes in. So it's a system using cameras that kind of maps the surface of your body. So we know based on how much your body surface is changing, whether you're doing that same amount of breath every day for the radiation.
The time you have to hold your breath is usually about 20 seconds, and it's very, very tolerable. If you cough or have to exhale, we're going to see it on the monitor because this image guidance looks at your surface, and so you cough, it's going to turn that beam off, so you don't have to worry that you're not going to be in the correct position.
In terms of patient engagement, they really like the idea that there's something that's tracking them real time. It's also increased our efficiency as we really feel like we're able to get better patient setups, and our therapists have become really engaged in using VisionRT to enhance the patient experience.
AlignRT for left breast cancer is a phenomenal device. It makes treatments much speedier. It's very, very simple for the patients to follow. The coaching device is very straightforward. You see your own breathing, you know when to breathe in up into a green bar. We haven't had any patients that have failed to use the AlignRT system for DIVH. It's great, it works, it's clinically proven to work, so I would recommend any patient come and use the AlignRT system if they need DIVH treatment.